Welcome to another edition of the 2020 Celebrate Sisterhood Virtual Education Series. We're all looking for credible information to help ourselves, families and colleagues cope and stay safe during COVID-19. During the series, we'll share ways to thrive by staying physically and mentally healthy. We are here with you. You're not alone.
Hello, everyone. I'm Dr. Linda Bradley, founder and chairwoman of Celebrate Sisterhood. This is a community outreach and education program that empowers multicultural women to embrace self-care and to strive for optimal health for themselves, their families, and their communities. It's my pleasure to welcome you to another edition of our virtual education series, Celebrate Sisterhood 2.0. Today's event is pre-recorded, but if you have any questions about the information shared today, please email us at celebratesisterhood@ccf.org. My guest today is Dr. Teresa Dews, president of Cleveland Clinic's Euclid General Hospital, and the topic today is COVID-19 pandemic impact, lessons learned and actions to take. Welcome, Dr. Dews, and thank you for joining us.
Thank you for inviting me.
So let's talk about the lessons learned and the long-term disparities highlighted or amplified by the pandemic.
Well, we continue to learn lessons, and this is an evolving situation with COVID-19. And one of the things that we have come to realize is that access to medical care, as well as many other things that we associate with the disparities that we know occur in people of color and multicultural populations, those things have actually been highlighted very much so during this pandemic. So one thing that we've noted is that there is a significant disparity between the number of people who've had serious COVID-19 infections and the disease, and even an increase in deaths among multicultural people and people of color.
Why do you think that's so?
Oh, there are probably many reasons to that, Linda, and many of them are related to our differences in our health status, as well as some of the socioeconomic determinants of health. That's called SDOH.
Excellent. And can you tell us a little bit more about so much in medicine these days has to do with call your doctor on the phone, do a teleconference, go through our EPIC system in terms of needing digital access. What is our community? What do we know about the Cleveland Clinic and its potential in terms of accessing patients in our community that may be considered less resourced?
Well, there are many different things that the Cleveland Clinic has done to reach out to patients. First of all, the access is very challenging. Not everyone has access to Wi-Fi, the cellular phones. There are a wide variety in the types of cell phones people have. And many of the public libraries have been closed during the pandemic. And so access that people used to have, they no longer necessarily have access to it. So the Cleveland Clinic developed multiple platforms in order to reach people in order to continue care. Some of that was based on virtual visits and video visits, so you could use a computer or your cell phone, but also there are many telephonic visits. So even if you didn't have a fancy cell phone, then you could at least have a phone call from one of your providers to take care of you.
Do you have any feedback from our patients who may have had the opportunity to do virtual visits either by phone or by video? Anyone at Euclid Clinic that you have a story, an anecdote that you can say how patients may have enjoyed or liked this digital access? Tell us a little bit more about that. Because it's new. Because it's new. We haven't done this before.
Mm-hmm. It's very new. So I see. I've taken care of patients virtually, personally, and there's a wide range. So some patients are very confused by the technology. It can be challenging to get on. Connectivity can be variable. However, once it actually makes that connection and the patients get on, they actually enjoy the format. They enjoy it tremendously. Some of it is the convenience, where you don't have to leave your home and get into a car and worry about exposure. The appointments tend to run on time for the most part, and so when the patient signs on, then they're actually able to connect to the doctor or to the provider. And then the other component that the patients will say is, I have the undivided attention of my provider. And so that is a very good interaction that people are starting to really benefit from.
That is so true. And I can put a shout out to being a physician doing this a lot. You don't get double booked. So that's another, and it is undivided attention to our patients. So I think that this is a lesson learned, and I think if we can take this forward, it will be quite helpful.
I think it will, and I think that the acceptance is going to widen.
Excellent. Tell us a little bit about diagnostic testing and supportive treatment that's out there for COVID patients. How does a patient access how does a patient access diagnostic testing as we know today? This is definitely evolving. But what does a patient need to do? How does it happen?
The first step is actually contacting your primary care physician, letting them know what your concerns are and letting them know what your symptoms are and why you want to get tested. And then the primary care physicians, all of them have access to at least providing testing to appropriate patients. So again, this is evolving. We are trying to expand the number of patients who are getting tested. And so what it used to be very limited, but it is definitely increasing as far as the number of patients who can be tested. So talk to your doctor and let them know that you were exposed or you're not feeling well, and that way they can take care of you.
Excellent. I do want to put a plug at the end of the program to go to the Celebrate Sisterhood website, because there we'll have a lot of materials to let you know where testing occurs. It used to be only at the Walker Center. Now we have a multitude of places to go. So we are evolving, and we want to let you guys know that the community concerns were heard, and we now have places around our city and our community. So that's important. Now, patients are sometimes afraid of coming to the hospital. Tell us how we've mitigated that in order to prevent delayed treatment. And what's the problem with a delayed treatment or emergent treatment? Give us a little feedback about that.
Linda, that is very important. So initially, patients became afraid to go to the hospital because we were so concerned about a huge influx of patients. We were trying not to be overrun with very, very sick and ill patients. And so there was some discussion, there was some communication to our patients to not come to the hospital unless they had specific medical needs. Unfortunately, what that translated to was that many people who needed to be seen by their doctors, who needed to go to the hospitals, decided to stay home. And then there was additional translation to being afraid to be exposed to other people. So we have done a lot to try to make sure that people are safe, as well as communicating that safety to patients. So one of the things that we do is everyone is encouraged to wear masks that come to the hospital, and all of the healthcare providers in the hospital are required to wear masks. Additionally, we're very in tune with the social distancing, and unless the provider is providing direct care to the patient, we really are trying to do that ourselves. It's a very difficult thing to do. We understand how challenging that can be. We have increased the frequency that things are clean. We've spaced things out. We have limited visitation from families and other people in order to decrease the number of people in the hospital and to provide that distancing. So there have been a lot of changes in the hospital to definitely make sure that this is a great place to come, that this is safe to come, and you will be well taken care of. Do not stay at home and delay your treatment.
I know you and I have talked over coffee about the potential for worse outcomes to medical treatment, and it sounds like the lesson learned is to see your doctor. It is safe to come to the Cleveland Clinic. It is safe to speak to your physician, and this is an important lesson learned. As I think about the severity of COVID-19 and death associated with patients, we've heard a lot about chronic medical conditions. Tell us more about that.
Chronic medical conditions there's a wide range. The ones that have been associated with poor outcomes when it comes to COVID-19 really include the lifestyle-related conditions, or what are considered lifestyle-related conditions. So these are things like metabolic syndrome, diabetes, heart disease, hypertension, smoking, many of which have a higher prevalence or are present at a higher rate among multicultural people, as opposed to the general population. So when COVID-19 someone has COVID-19 or the disease caused by the coronavirus or the SARS-CoV-2 virus, if you have metabolic conditions or chronic medical conditions, you have a higher chance of having a more severe illness or even dying from the disease. And so we have to start paying attention to that.
Excellent. You know, we've all been against smoking and now even the e-cigarettes. Is there any impact of lung disease with COVID? Can you tell me a little bit more about that?
Yes, unfortunately, COVID has a lot of presentations, and so the first presentation that we were aware of was the lung disease. And so people would get, severe cough and aches and a fever, and that's what those were the first symptoms that we lined up with COVID-19. At this point in time, there are multiple symptoms that people can start and present with. However, focusing on the lung conditions, when people smoke, and that's smoking directly or even secondhand smoke, we know that they can have chronic inflammation in their lungs related to that activity, to smoking. And one of the problems with COVID-19, the disease of COVID-19, is that inflammation in the lungs decreases the way that we're able to give oxygen to the body. And that's the complication of having that virus.
Excellent. I do have to put a pointer that the Cleveland Clinic has been very much involved with our Respiratory Institute and pulmonologists about smoking cessation programs. Again, go to our website at the end. There are many things that you as listeners may have, the diabetes, being over your ideal body weight, hypertension, as Dr. Dews has mentioned. But do know that we are a center of excellence and have many physicians and healthcare providers that will help to decrease some of these comorbidities. And while we're exposed to this right now, I've learned a lot from Dr. Dews. Do know that there's help here at our institution. I want to now just look at other impacts of social determinant on health. What about money? What about finances? About our patients and community job force? What do we need to know about that in terms of its impact on COVID?
Well, all of those things have an impact, and they have an impact because what we know is that they contribute significantly to someone's exposure and risk of developing many of these chronic illnesses. And so when you have a higher chance of developing these chronic illnesses, then all of those things impact it. So stress, difficulty with money, being considered what we call now an essential worker, meaning that you are at the base of providing so many things that we need in this society. And many people who are essential workers did not have the option or the opportunities to isolate themselves. They had to go to work. They had to take many of them, not all, but many people have to take mass transportation or public transportation. Many people had had to face the public, so they had more exposures. So many of the things that we associate with those social determinants of health really do impact not only your health, but also your ability to take care of yourself and even your family.
Yeah, this really sounds tough on many levels. Do you have any words of wisdom on ways that we can figure this out to move forward?
There are a lot of things. One, I think it's important to have a good mindset that when it comes to health, we need to start thinking about not just being not sick, but actually promoting health, promoting wellness, thinking about prevention. So not waiting until you're sick to go to the doctor, but developing a good relationship with the provider that you can work on over a period of time in order to make yourself healthy. So many of these conditions can be improved, and we have to understand that. And so there's a lot of things that we can do, and I would love to talk a little bit about any of them.
Okay. Just help us. Where do people live? Their neighborhoods, their physical environment. Let's move from the job to their homes in terms of housing conditions. Tell us what we're seeing as physicians, how we should look at things, what patients might be able to do.
Well, there are many things that are critical here. One is the type of conditions under which people live. Many people live with very condensed, highly populous conditions. And what that does is that you have more exposure potentially to different diseases and to different viruses and illnesses. And so trying as much as possible to keep things as clean as possible, having a way to isolate yourself if you are sick, or if there's a member of your household who's sick, then that is very important to try to be able to do. It's not that easy, but it is something that everyone can look around their environment and say, you know, there are opportunities where I could move this. We have to look out for our vulnerable population. So many people of color, multicultural people, have family members who are in skilled nursing facilities or rehab facilities. And that's another place where people are vulnerable and there's potential exposure to viruses such as the flu and coronavirus and COVID-19. So again, any opportunities that we have to look around at our conditions and see where things can be improved are going to be very important, knowing that not everybody can control everything.
I agree with you, Dr. Dews. Very good points. Other impacts on social determinants, and we're now seeing quite a few things that we've talked about, from where you work to where you live. What about education? What about food? Can you elaborate on that a little bit more?
Well, education is challenging, and we have seen that all of our children have had to come home and homeschool. And there have been discrepancies between people and their ability to access computers and have access to Wi-Fi to even continue their education. So again, COVID-19 has highlighted disparities that people undergo every day, and pull the rug out from under people who are really trying to do well and try to get ahead with their education. The other component is just even linguistically, different languages that people use. If English isn't your primary language, or if you're a migrant worker or undocumented worker, then you are definitely at a disadvantage when it comes to any type of trauma or any type of emergency that occurs, such as what we're dealing with COVID-19.
Excellent. And I would also point out, for those who have English as a second language, that the Cleveland Clinic has a phenomenal translation services that folks can get, even if they're deaf, even if they speak a different language. I mean, literally within about 1 minute, you name the language, we can get an interpreter by computer for them. So again, another reason to seek health here at the clinic, because we really have advanced our services. And I've been, as a physician, just last week I did surgery and a patient did not speak any English, was Spanish speaking. And I quickly, within 30 seconds, got an interpreter, and she needed to know everything in terms of surgery and even getting her COVID testing. So I want to just put a plus, an A+ for the clinic for those kind of programs that we've developed, and we've really amplified them to help decrease some of these impacts of social determinants. We all have to eat, Teresa. So what about food? What about the social determinants of food and health?
Well, we talk about food security quite a bit. And what many people don't understand is that access to high quality food is not equal. There are a lot of inequities in what people have access to. And when it comes to health, your habits, including what you consume, is very, very important. And so, you can't develop, you can't be healthy if your diet is dominantly junk food and treats and sugar. And we need to re-emphasize and get back to, the basics of understanding, a treat being a treat, which is something that you enjoy on occasion, as opposed to a daily staple. And so one of the things that is very important is making different choices as far as where you purchase and obtain your food. There are quite a few things that are available now, such as farmers markets, that allow access to fresh, high-quality food at much lower prices than some people, have been exposed to before. And those are becoming more and more prominent. And so you can search those out or seek those out. And even in the grocery store, understanding that just because it's convenient doesn't necessarily mean that it's good for you. And developing some techniques that allow you to prepare delicious, simple, healthy food so that you can build up your body, so you can protect yourself, so you can be healthy, so your children can be healthy. That all of that is extremely important. And again, just to drill that home, soda pop, and I'm dating myself because I said soda pop. Soda pop is not something that is healthy, and everyone knows that. But when you're drinking it and you're drinking other sugary beverages, that is going to contribute to you not feeling well, for you not being as healthy as you possibly be. That's just one example, and there are many, many others.
Excellent. Well, I've always loved cooking, and as a part of Celebrate Sisterhood, we've always had cooking as an important platform within our program. So I do want to let our listeners know that at the end of this series, we are planning on putting together what I call, and I've been working on, the Celebrate Sisterhood Quarantine Cookbook. It'll be an e-cookbook that will be available at a much later date, but I've been keeping my own recipes and trying to look at what my patients may be eating, doing exactly what you said to make it affordable, easy, things that are almost in your pantry, tasty, colorful, and easy access. So I think with summer just here around the corner, we can eat from the rainbow, hopefully find farmers markets, and I totally, wholeheartedly agree with what you just mentioned. And I do want to move on to the impact of social determinants in terms of looking at the community and social context. I know we've talked about some of these, but tell us a little bit more about the community and social context as it relates to impact of social determinants of health vis-a-vis COVID.
Yeah, the social context is, it's actually very complex. Okay, so where you live, the amount of stress that you're under related to where you live, domestic violence, safety, things that many people take for granted, and understandably, these things can happen anywhere. We know that. Okay, there are no walls when it comes to people living in difficult situations. However, if there's a higher level that, based upon where you live, that is going to impact your health. It's going to impact your health. And what we have come to understand, if your health is impacted, then COVID-19 may be more severe for you. So it's really important for people to be able to identify areas, places where they can or need to be safer, and to act on that. And one of the things that's important to understand is that the medical community does have resources, the health departments do have resources, and so there is help for some of these things, and it ranges from social workers and case managers, professionals called patient navigators that are there to assist you in, okay, I have these issues. How can I get things done? How can I make things better? And no one has a magic wand or fairy dust, okay? However, you don't have to go it alone. Many times if you communicate with your doctor, you communicate with your provider that you need help, just ask, and people can, in many, many cases, find a way.
Can you tell me a little bit more about the patient navigator? This is something, a unique new concept. I'd like to learn more, and I'm sure it's a term that most of our listeners don't know about. So what are we doing around that?
Well, in some of our centers, such as the Stephanie Tubbs Jones, we have people who are called patient navigators, and what their role is to help people access the next steps as far as their health care, as far as their medical care. So, for example, I'm a doctor, and I'm going to write a bunch of different orders for you to do on your own, okay, and come back and see me in 3 months, and then we'll see what's going on. Believe it or not, part of the reason why people don't do well when it comes to medicine is because a lot of the times we tell them to do very difficult things, very challenging things. So a patient navigator is someone that can hold your hand, take you by the elbow, and assist you in, okay, the doctor wants you to have the following visits or follow-ups. Let's schedule these appointments now. Let me make sure that you have those numbers. If you have barriers to being able to do it, the patient navigator is someone who is able to get that information from you and assist you in removing some of those barriers. So something that is very unique, and it's relatively new. And from what I have seen, they do a phenomenal job in helping people navigate being patients.
Do you think this is available at most of our Cleveland Clinic facilities?
Not to my knowledge. I believe that it's only in certain facilities at this point in time. However, there are people in almost all of our outpatient facilities that have a role of assisting patients. But the patients, and this is where we as patients, and all of us are patients at some point in time, this is where it's important for us to be able to speak up and be able to know what our needs are, and then be able to express them. So if your doctor doesn't think of it on their own, you can say, I don't know if I'm going to be able to do this. I think I may need some help with this.
Excellent, excellent. So that actually looks at one of the next things I'd like to begin talking to our viewers about is the actions to take, getting healthier. There's an old adage that says when you look at the word illness, the first letter is I. If you look at the word wellness, it is we, W-E. So, Dr. Dews, let's begin to talk about actions to take to getting healthier. So what is a wellness mindset? Can you tell us a little bit more about that? Or do you believe in such a thing? Tell me a little bit more about that.
A lot of it has to do with someone's outlook. So you have people who they think that it's normal to not feel well. It's normal to be sick. It's normal to feel unwell every day. And then you have other people who, wait a minute, I'm not feeling the way that I feel that I should. And so they tend to be a little bit more assertive about the need and the understanding to feel better. So what I like to communicate and what I talk with my patients is that, it's important for you to understand that you can feel much better than you actually do now. Okay, so I think it's very important for people to have that mindset and a can-do-it attitude. And then the other part of that is having a plan.
Tell me what those plans might look like. If you were coming up with a template, what might one of our patients or one of your patients do when you say have a plan?
Yeah, so it's important for people to look at their personal habits, and everybody has personal habits that are that are good for them and self-health promoting. And then, most of us will have a habit or two that we know that if we did a little bit less of something, then we would be better off, okay? Or eliminating it entirely. So part of it is developing a plan, pick and choose. So you know what? I'm going to make a commitment to exercise more or to move more. You make a plan, you look at it and say, what is it that I really want to get from this? And then you also want to look at, well, what's your why? For some people, it's the personal experience of feeling better. For other people, it may be that, I want to be around for my grandchildren. Everyone is going to be different, but it's very important for people to have a why.
Excellent.
And then to try to have a plan. How am I going to go about doing this? So a very good example would be, okay, what if I wanted to eat fewer cookies? Okay, I didn't want to snack on cookies all day. So your plan can't be to have the cookies in your cupboard around all of the time. You have to think of something else, because otherwise you're going to eat those cookies. We all know that. There's only so much willpower in the world. So if your plan could be, if I'm going to have a cookie, I'm going to get cookies, I'm going to enjoy them, but I'm not going to keep them in the house. And that's something that could be very simple. And you try it out and you see how it works for you. And the other part of making changes in personal habits is, you want progress and you want to continue to make progress. But when you're looking for perfection, many times that undermines you much, much more so than not even getting started. If you feel that you have to do everything perfectly, then you're just not going to be successful. So there are a lot of things that people can do in order to change things. The other thing that's important is working with your healthcare provider. So I mentioned earlier that you don't want to wait until you're sick. You want to develop a relationship with a provider. And you want to develop that relationship over time. And there are a couple of techniques that you can use to keep up with things and to understand what's going on with your body and with your health.
Dr. Dews, you and I have known each other as you put my patients to sleep for the last 20 years. Our audience may not know her as an anesthesiologist, but she was one of the best, and now she's president, of course, of Euclid. But I would say from all of your great advice, you could almost become one of our new primary care doctors, because the advice that you're giving is so real. I might add to what you've said is that write a contract, date it, sign it. What does it look like when you stop eating the cookies? What might it be when you go to see your internist in terms of your blood pressure, your weight, your cholesterol? And also tell a friend. Get a buddy to help you with meeting some of these goals, and get a buddy that's going to whip you into shape and make you very much accountable. So this idea of controlling what you can control, I think putting it down on paper and listening to what you just described is really, really wonderful. What other personal habits do you think our patients need to know about? Anything else?
Activity. Activity is very important. So when people think of activity and exercise, I think they overthink it. For the most part, it's just moving. And people need to get into their head that they don't want to sit for too long. They don't want to stand for too long. They want to move around. The weather is changing here in Cleveland. And so when it is safe, so we have to keep safety in mind. You really want to get as much fresh air, keeping in mind social distancing, okay? But you want to get fresh air and you want to get sunlight, particularly people of color and people who are multicultural. Sunlight is very important. And we don't get enough of that in Cleveland as it is. So you need to get out there in order to expose yourself to sun in a positive way. And then walking as much as you can walk for as long as you can walk. Again, keeping in mind you want to be safe when you're doing it. So getting up out of the chair or off the couch or up from the dinner table on a regular basis, away from the desk if you're a desk worker, even if you have to time it and set an alarm to get up and move, is going to be very positive for you in the long run.
Again, we're going to hire you as a internist because I, as a primary care OBGYN, I never use the word exercise with my patients. I use the word that you just said, move. You know, Mrs. Brown, can you move by walking up the stairs? Can you move a little bit more by parking your car further? Can you move a couple of times as the commercial is on television? But I found that the patients will buy into that a little bit more than the word exercise. And now let's just move on to what can patients control? What can they do in terms of getting control over what they can control? Tell us about that.
That's going to be different for every patient. But one of the things, if we list the things that we know contribute to good outcomes and good health, one is sleep. You can control your sleep. So you want to get good quality sleep. You want to have a regular sleep routine. You want to limit doing high excitation things at night before you go to bed. You want to monitor the amount of screen time that you have in your bedtime. And so developing good habits around sleep are very important. What a lot of people don't understand about sleep is that is one of the major time periods that our body is healing. So if you shortcut sleep, if you don't get enough or if it's not good quality, then you're shortchanging your body's ability to heal. Another thing is stress. Everyone is exposed to stress because that's one of the ways that we're wired as human beings to experience stress. It's what gets us moving. It's what gets us out of bed. However, if the stress is continuous, if it's constant, if it's severe, then it starts to work against you. So recognizing that we all have stress, it's very important for us to figure out ways to identify it, minimize things that are unnecessary, because we know that there's some unnecessary stress we expose ourselves to, and then also developing techniques to decrease your stress. These don't have to cost a lot of money, or any money for that matter. So what we were talking about before, such as, exercise and movement, that can be a stress reliever. Breathing techniques can be a stress reliever. Increasing interactions with family and friends can be a stressor, but it can also be a stress reliever. You have to understand what your circumstances are. So there are many different things that we can do. Food we've talked about, but that is a very critical thing. Anything that you consume is going to manifest into your body. And so you really want to start changing your attitude and your mindset around quality and being pickier about the things that you consume. And then there are different substances. So, there are a lot of things that are around. There's alcohol, there are drugs, and we really need to focus on being very cautious with those because they take away much more so than they give. From the stress standpoint as well as in our communities.
You're giving us so much vital information. What are other credible sources of medical information for our patients in our community?
Yeah, so getting good sources or getting good information is very important. And it's also important to get it from different sources. So believe it or not, again, your primary care provider is a great source of information. They can guide you. They can explain things to you. There are online sources that are very well researched, such as the Cleveland Clinic websites, as well as WebMD. There are many, many others that are associated with the hospitals. And those resources are free as long as you do have access to the internet. The public library is another good resource. And the librarians are excellent. You can go to a librarian and say, I'm interested in hypertension and I need to know more information. And the librarians are very, very good as far as assisting you in gathering that information. So there are many, many ways that we can get information.
Excellent. And I might add, since the pandemic has hit, even for me, I was always someone to walk into a library. But using your free library card, you can watch videos, podcasts, books. You can be put in a line or a queue to get a book. So even if the libraries slowly reopen or have limited services, that the public library is a gem in our community. And also I will have on our website, the cdc.gov, always updated on a daily basis. So it's important to get real news, not fake news, as it relates to your health. And I love the word that you use. Using credible sources is so important. What other things do patients need to know about taking care of themselves and their families? What are some just other general things? It's been hounded into us a lot, but just tell us what those things might be.
Yeah, so it's particularly in this era of COVID-19, hygiene is really important. And by hygiene, we're talking about things like hand washing. And that is so basic. And really, it's just taking soap and water and washing your hands for 20 seconds or more. And you really want to soak them up. And it's not only the soap, the detergent action of the soap, but it's also the friction. It's actually rubbing off, any bacteria or viruses. That is very important for us to do. And we need to improve upon that. When you cough, there's cough hygiene. So coughing or sneezing into your hands, that's just an opportunity to transmit the virus to a surface or to another person. So you really want to either have a mask on or cough into a tissue and throw the tissue out. Or if you don't have access to any of that, even coughing in your sleeve will decrease that transmission. Mask. Almost everyone at this point in time has a mask. We encourage it strongly. The reason being is that it decreases the virus particles that other people are exposed to. So if I happen to have the coronavirus or SARS-CoV-2, and even if I don't have any symptoms, I could communicate that to someone else. I could transmit it to someone else, someone that I care about. But if I wear a mask at work, in the home, if there are vulnerable people in the home, then if I do have the virus, I'm giving less of that virus to someone else. And it gives them a chance to not get sick because of me. So I understand that they're uncomfortable and people aren't used to them, but they're so important as far as limiting the transmission of this disease.
Any ideas for those of us who do have to work? How do we safely commute, whether you're, no matter what your job is, and you have to go out to a store now and then? Tell us a little bit more about that. What suggestions might you have?
So the mask wearing is very important, okay? And it's also important to stay away from people. So we know that the virus is, communicated by droplets. And so when people speak, then you can come in contact with the virus. So it's really important to maintain that social distance as much as possible. Wiping down surfaces, and again, it doesn't have to be an antibacterial chemical. It can be something as simple as soap and water. That would be very good. Washing your hands frequently. And also, if you have concerns about your safety, as is reasonable, having a conversation with your boss, with your workplace, and say, we really need to be very cautious here. And are there any opportunities where we can change the way that we work, change the location of different workstations, put up barriers so that when the public is interacting, or when you're interacting with the public or other people, you have additional safety precautions. And many employers are actually working really well. I mean, when you go to the grocery store now, most of the grocery stores do have a plexiglass barrier between you and the cashier, and it's for your protection as well as the cashier's protection.
Excellent. One of the things that you and I are both are doctors. And in Latin, the word doctor means teacher. And I know from your years of service, Dr. Dews, that you've been that, and I hope that I've been that too. So how can our patients, and I think I take my role as an OBGYN physician extremely seriously, and almost religiously in terms of the trust that's needed and being able to work with my patients. Can you now let's move into how patients can work effectively with their medical providers, and that's doctors. There are many people in our team, including nurses, others who are with us. Tell us more, and let's dig a little deeper in terms of how to have an effective relationship with medical providers, and tell me what you've learned over time.
Oh, yes. I think that that's very important. And in addition to being an anesthesiologist, my practice is a pain management physician. So I do a lot of one-on-one taking care of patients over the course of a long period of time. So I've taken care of families and I've taken care of people for decades. I've had the honor of doing and the privilege of doing that. So what I have found is that relationship is really key. So everyone has biases. We all do. Again, that's how our brains are hooked up. That's how we learn about the world, and that we make assumptions. And it's on both ends. Everyone has them. You have to recognize what your biases are. And even healthcare providers, they are learning more about recognizing what their biases may be when they're interacting with patients and the public. Very, very important for us to do that. The other thing is we want to treat each other with mutual respect. And if for whatever reason you feel that you're not being respected by your provider, give them the opportunity to know that, to learn from it, and to make up for it. And I can give an example where I was having a busy, crazy day, and I was getting a bunch of phone calls and dealing with a lot of things. And then I walked into a patient's room, and according to me, I just did what I was supposed to do. I took care of that patient and everything was fine, right? That patient made me pause, and she said, Dr. Dews, you don't seem to be yourself today. You seem a little gruff. You seem a little edgy. And so whatever was going on outside of the room, I brought into the room with me. The relationship that I had with that patient, she felt comfortable enough to tell me that she didn't feel that she was being treated well. So not only was I able to understand that and correct it, definitely correct it, it needed to be corrected. But it also enriched that relationship, and I was able to really take care of the patient the way that she needed to be taken care of. So give your provider an opportunity that if you don't feel that you're being well treated for any reason, give them the opportunity to clarify and make up for it. And if they don't, then perhaps it is reasonable for you to seek out another provider. Okay.
I was going to say, I really appreciate your honesty and your own self-reflection. That's so important as physicians in the lives that all of us lead, and also to not make it an excuse because we're busy and we have meetings and we've got places to be. So that personal antidote is really well. What else do patients need to know in terms of how to work effectively with providers? I was thinking about research. Do you like patients asking you questions, and does your authority diminish? Tell us about what patients need to do about seeking their own care and to get the better care.
I think it's very important for people to do some research. So if you were going to buy a car, you unlikely would just walk into any lot and buy the first car the salesman, offered you. You would do a little bit of background research. This is your body. This is your health. You want to have a good understanding of what's going on with you. So getting some research ahead of time is important. And no, I have patients asking me questions, and even doing online searches and patients saying, well, I saw online this particular remedy or this information about, what's going on with me. I take that as an opportunity to meet the patient where they are and to educate and be a doctor, as you described, Linda, to be a teacher for patients. And there are many times where patients will bring information that I haven't come across. And so that's my opportunity to learn as well, and then bring the information back to the patient and reframe it so that we're on the same playing field, so that we both have a good understanding of what's going on. So it's very, very important. I also encourage patients to prepare for their visits. And so come with questions. Come with some of the research that you have. Come and explain to me in your own words, what do you think is going on? You're a patient. No one's expecting you to have a medical degree and speak medical lingo. But it is important for you to have an understanding and being able to express what you feel is going on.
Excellent.
I also recommend that people take notes and describe, since this is a follow-up visit, Dr. Dews, since the last visit, this is what's gone on with the way that I feel. And by taking those notes, you can say, this is what's better. You could say, this is what's not better. And sometimes you can say, this is new since we talked the last time. And that's really good guidance, for your physician. So if you come with a little bit of research, some questions, and also, an update as far as your conditions, believe it or not, your doctor is actually going to like that, because it really is going to make the visit very effective and very efficient.
Excellent. And I'd also just add the issue of what I call talk back. Once the doctor has explained something, just if you're a patient, just say, Dr. Dews, this is what I think I heard you told me to do. I should take this medicine every 4 hours for the next week. Or I should take 4 at a time every day for the next week. And so we get to understand what you get to understand. So I think that's very, very important. And finally, I would just like to have you to tell me about the types of notes and how you want a patient to look at her appointment notes. You may have mentioned earlier having questions, but other things that they should know about.
It's very important for them to understand what the follow-up is. So, we're moving very quickly. We're trying to get a lot done. We're trying to take care of you. We're trying to get as many things packed into that office visit as we can. And so sometimes we'll rattle off a list of things for patients to do. And I encourage people to write down the things that you're expected to do between visits, and then, take that with you and just do a checkbox of, okay, I'm supposed to make these follow-up appointments. I may need these laboratory or blood work, or I may need an x-ray here. And that way you can make sure that by the time you're ready to see your doctor again, you have done the things that you need to do. And everybody's organization is different. Some people can keep things in their head. Most of us are distracted and they can't. And by the time you leave the doctor's office, you've forgotten half of the things that you think you were going to remember. So I just think that writing it down as far as what your next steps are very, very important.
And I'd also just like to emphasize, Dr. Dews, in the era of COVID, sometimes we can't have our family or friends or loved one with us, but most physicians will allow a cell phone so that the conversation could be listened to, whether they're waiting for surgery or outcomes, or if your mother or brother or someone's there. So I think that's another resource. I'm going to give you 15 to 30 seconds to just give us a minor clip. Anything that I didn't ask you about that you think our Cleveland Clinic Celebrate Sisterhood audience needs to know.
Well, first of all, I'd like to say, Linda, thank you so much for doing this. This is so important for people to have this information. So everyone needs to know that it is safe to come to the hospital. You want to come to the hospital. You want to see your doctor. You don't want to delay your care. It's very important for us to move to this next phase of taking care of ourselves. We want to make sure that we become sophisticated and educated and partners in feeling better and being healthy, not only for COVID-19, but just because we don't have to be as sick as we are. But it's going to take that I to move forward into feeling better and working with the we of the caregivers, just like Dr. Bradley was saying before. So, and last but not least, with everything that is going on with COVID-19 and all the other stressors that are going on in the world, when it comes to how we face the day every day, that is something that we have control over. And it's important for us, it's important for our families, and we can contribute to the positive change that needs to be.
Thank you. What an exciting discussion. Let me just say a special thank you to you, Dr. Dews, just for sharing her time and her expertise. Thanks for helping us understand what the road to recovery looks like. And thanks to all of our viewers for joining us for this historic Celebrate Sisterhood program. We hope that you've enjoyed this session. And remember, please remember to share this with your family and your friends on social media. A copy of this session will be available on our website. And just a reminder, today's event was pre-recorded. If you have any questions about the information shared today, please email us at celebratesisterhood@ccf.org. As we end our session today, I want you to remember to embrace self-care and strive for optimal health for you, your family, and your community. We are confident that lessons learned today will enable you to manage your new normal. Please stay healthy and stay safe. Thank you.